knock, secure privacy, and hand sanitizer. Hi, my name is Kim. I'm going to be your student nurse for today. Can you tell me your name and your date of birth, please?
Diana Kiwika, June 2nd, 1995.
Awesome. So I'm going to be going to do a head and neck assessment for you today. So I'm going to start with a couple of questions, okay? So, have you been feeling any headaches?
No.
Any pain? Any changes in hearing or vision?
No.
How about any nasal occlusion?
No.
Difficulty in breathing or swallowing? How about any drainage from your eyes, your nose, your ears, or your throat?
No.
Any of those? Okay, good. So I'm going to go ahead and start just by inspecting your head. So I can see that your head is upright, it's still, there's no involuntary movement, and it's normocephalic. Your neck is erect, and I'm going to go ahead and check the range of motion for your head and neck, okay? So I want you to just go side to side. Alright, up and down. Good. There's no limit in your range of motion for your head and neck, so that's really good. Now I'm going to go ahead and just start with the skin integrity. So I can see that your skin is intact, it's smooth, and I don't see any abnormal lesions. The skin is uniform in color. That's good. And then I'm going to go ahead and move on with your eye external features. So I can see that you have 2 eyebrows and 2 eyes, obviously. And the hair growth for your eyes and your eyelashes are distributed evenly, and it's normal in hair growth. And your cornea and your lens, they're clear. I don't see any fogginess. And your sclera is white. That's good. I don't see any signs of redness or irritation. So I'm just going to go ahead and check your conjunctiva, okay? Good. Your conjunctiva is light pink. There's no swelling, there's no signs of inflammation or irritation, and they're moist. Same thing with your lacrimal duct. I don't see any crust, I don't see any drainage, and they're moist. That's good. Now I'm just going to go ahead and test your pupil reaction to light, okay? So I want you to go ahead and look at my shoulder. Excuse me. Just look straight as I flash the light, okay? Good. So I'm just going to go ahead and check for the symmetry. So good. Now I want you to go ahead and just follow this pen light, okay? Good. So based on that test, the result that I found is that the pupil size is 4 millimeters, and when it reacted to the light, it constricted and became 1 millimeter. And then as the pen light was getting closer to you, your eyes were constricting and converging, and when I was pulling it away, it was dilating and diverging. So that's really good. That means that it was accommodating, right? So I can tell that your pupils are equal, they're round, they react to light, and they accommodate. So that's good. So now I'm going to go ahead and move on to your nose. So your nose, just from looking, I can see that it's midline, it's not crooked, there's no deformity, but I'm going to go ahead and look at your nares. Okay, so your nares are symmetrical, and your septum is midline, it's not deviated. The hair growth in your nares is also normal, and the skin color is the same as your facial skin color. That's good. And then now I'm going to go ahead and just test for your nasal occlusion. If you could just hold one nose, breathe out. Good. The other one, exhale. Good. So there's no nasal occlusion. And now I'm going to go ahead and move on to your ears. If you could just, yes, thank you. Just by looking, your ears are symmetrical and even. It's not too big, it's not too small, and the top of your ears is in alignment with your eyes, so that's good. I'm just going to go ahead and palpate to see if there's any bumps, lumps. Okay, so I did not feel any tenderness, any lumps, or any lesions. And just by looking, not see any signs of drainage as well. So that's good. And the skin color of your ears is in uniform with the rest of your face, so it's really good. And any pain in your ears? That's good. So we're gonna go ahead and move on to your lips or your mouth. So your lips for first, it's good, it's moist, it's pink, it's not cracked or dry. So that's good. I'm gonna go ahead and ask you to just open your mouth for me and stick your tongue out. Can you move it side to side? Up. Good. So your tongue, it's midline, it's pink, it's moist, that's really what we want. And you were able to move it voluntarily. And I could see that in your ventral tongue, it was veiny, it was pink, it was moist, and there was a pool of saliva in there. So that's what we want to get, right? So now I'm going to go ahead and ask you to just smile for me. Beautiful. So you don't have any missing teeth, and your teeth are white, they're shiny, they're clean. And your gums, they're pink and moist, and I did not see any signs of bleeding or inflammation. So any uncomfortableness in your gums or teeth? Good. All right, I'm going to go ahead and move on and check your throat for you, okay? If you could just open your mouth again, stick your tongue out and say ah for me. Good. Okay, so same thing. Your mucous membrane for your throat is actually pink and moist, and I did not see any signs of swelling or edema. And then your tonsils, I could not see, so I'm going to grade it a 0, which is a good thing. And your uvula, it was midline. When you said ah, it went up, so that's what you want. And it wasn't swollen, it was just pink and moist. So that's good. Okay. And I'm going to go ahead and check for your carotid pulse, okay? Good. Carotid pulse is 2+ and it's strong and it's really good and it's bilateral. And then now for the last part of it, I'm going to go ahead and just palpate your lymph nodes. Okay, tell me if anything hurts, all right? Okay. Your preauricular, postauricular, occipital. I'm going to start with your superficial cervical, then deep cervical, posterior cervical, your submandibular, submental, and I'm going to go ahead and ask you to just lift your shoulder up to your supraclavic. So good news is they were non-palpable, so that's normal. I did not feel it, and do you not feel any pain for that? Okay. And just one last thing for the facial features. I just want to say that your nasal labia folds, they're symmetrical, which means one side is not drooping compared to the other, so that's really good. Overall, this head and neck assessment was pretty good. If there's anything